Hi Pavithiraa, welcome. And today in V for Wellness, we are starting the day one, the wonderful wisdom. And, can't wait to listen your sharing for tonight. And thank you. Stage is all yours.
Hi, hi everyone. My name is Pavitra, and today we are going to have a look at this book named Many Lives, Many Masters by Dr. Brian Weiss. So the story, I'm going to tell it in the form of a story. Okay, so today we're just going to see chapter one and two, and yeah, here we go. So the story starts with two people. Okay, so first one is the psychologist. His name is Dr. Brian Weiss. So he's this really big psychologist now. He's the head of psychiatry in one of the big hospitals. Okay, and we have another person that's the patient. Her name is Catherine, and she also works in the hospital as one of the equipment related some job. Okay, um, so the problem with Catherine is she's having a lot of issues in her life and she's not able to have proper sleep. So she's having a lot of anxiety. She's having a terrible fear of water. Um, she's very afraid of heights. She's not she doesn't want to fly within like an aircraft or things, and she has fear with respect to almost everything, and which is leading to her having very bad sleep. She's also having a lot of sleepwalking, and she's also having frightful dreams, which is not allowing her to sleep at night. So with respect to, so what is happening is after a point, a couple of her friends in her colleagues in the hospital, they tell her that these symptoms are becoming very bad. You definitely have to meet with Dr. Brian, and you have to only meet with him and don't go to any of his associate psychiatrists. So okay, and she listens to this, but then she does not go back to the doctor. So the colleagues, they also come and say Dr. Brian regarding the patient, that's Catherine, and he kind of expects her visit, but then it takes her 6 weeks to come back to him. Because the symptoms are obviously worsening and there's nothing she's able to do about it, and she comes to Dr. Brian like a last resort. And so they start with their first counseling session, and definitely she speaks about, so there are few issues in her family. So the mother, she has had some mental issues, because of which she has undergone a lot of electrocution kind of therapy in her time, which again has freaked out the children and Catherine when she was a young child. And her father was an alcoholic, and so he had come back home and he used to hit Catherine and his mother and sometimes the son. And so this kind of things have been happening in her family, and this has kind of affected Catherine. The psychologist, the psychiatrist being like, he was very book based, obviously, so he definitely did a lot of psychotherapy sessions with Catherine, and he used the normal drug based interventions and all the normal things that a psychiatrist would probably do with the patient. But the thing is, despite doing any of these things, after Catherine goes home, she's not able to find any improvement in the symptoms, not even like 1%. So this kind of quizzes Dr. Brian because he's not able to understand where he's going wrong. And what happens is also she's having an affair with another doctor in the hospital itself, and who already has a wife and two children. Somewhere at the point of time, despite being extremely fearful of flying, she goes to a conference with this specific doctor. And over there, she goes to this Egyptian archaeology place, and the guide over there explains some things about this statues. And apparently, Catherine intervenes, and she says, like, more specific things regarding the Egyptian statues, even the guide doesn't know about. And the guide's like, okay, why are you interrupting me? And the guide even checks and confirms that, oh, whatever Catherine said seems to be correct. And the guide is more confused because he's like, how did she know about any of this Egyptian pharaohs or any of these statues wherein the guide himself didn't know. Hmm. So this kind of also startles Catherine because she's like, how did I know about Egyptian history? Because I had never read them. I had no idea about this. So when she comes back from the trip, she discloses this information to Dr. Brian, and this sparkles Brian's thought. And Dr. Brian is like, okay, you know what? Why don't we do a session of hypnotherapy? Many a times hypnotherapy does help patients open up about their past. Many of them which are like which are not able to access. So the next set of sessions, they start with hypnotherapy, and the first session, what happens is they go. So Dr. Brian asks the patients to, as usual, calm down, and they go back through the ages. And at the age of 3, Catherine confesses that her father has behaved in an inappropriate manner with Catherine, and in a sexual manner, and he had forced him. I mean, he had forced her by gagging her and things like that. So Dr. Brian understood that this could be one of the main reasons, since based on the book based, and he is like, okay, this is the reason for Catherine's anxiety and all her issues, and now that she has come to this realization, okay, definitely this is going to improve symptoms, but then unfortunately that doesn't do her any good. Defeated, they come back for this next session of hypnotherapy, and this time Dr. Brian thinks, okay, if at age 3 um, we figured out the trauma and that's not improving her symptoms, did something happen at age 2 or age 1? How is that even possible? But then he wants to probe further, and this time what he did was he didn't give her a specific age. He was like, you know what, just go back into your past and tell me what you see. Surprisingly, so this is where the events take a huge turn. Okay, so suddenly Catherine starts describing about something, and let me give you in quotations what she exactly says. I am in a market. There are baskets and pottery. People are shouting. I am wearing a rough dress. My name is Aronda, and this is very weird because we are going back in time and we are talking about age 3. So maybe if she's age 2 or age 1, how can her name change? And she speaks about, oh, I'm in a market and I'm in this basket pottery. She describes her clothing, she's describing her age, which is somewhere in the BC, and she's talking about carrying a child and about how she got drowned. And when she's drowning, she's gasping for air, and she's actually gasping for air in the chair too. um, this was very weird for Dr. Brian, but then he didn't want to stop it. He was like, you know what? Okay, go forward a couple of years and tell me what else do you see. Weird thing is now, from BC, she comes to AD, and in a specific age, she speaks about some other another name, and this time she says that she's a prostitute, and she has done so and so things, and she has done something different, and stuff. And also, she talks about somebody called Rachel. Apparently, this Rachel character is in her present life her niece, and apparently, this same person, Rachel, has also been there in the BC year that she has spoken about. Now, Brian is even more confused. And Dr. Brian, what he does is he's like, okay, so you have seen Rachel and you see yourself in two different characters, in yourself, in one in AD and one in BC. Do you see me in any of your past memories? And so what she says is, okay, yeah, and she actually names him in another name and tells that I have seen you teach me trigonometry. uh, and she's like, you taught me trigonometry but I didn't understand much, but you are a teacher and you know a lot of things. Now Brian is again perturbed because he's like, the problem is that now Dr. Brian is a psychiatrist, and he is a man of science. So now he's like, okay, if this person was dreaming, she cannot have the specifics. Like she cannot say everything in specific. She can't say what kind of cloth, what kind of texture, what age was it. The problem is she even went and checked back to see if she was lying, because if to see certain things had happened or not. But then apparently everything that she told had happened. And in the year AD, she talks about some sort of a plague that they all underwent, and a lot of people have died, and apparently, but she somehow survived. Um, and I think she was Greek in that no, she was Spanish. So in AD she was a Spanish lady, and in the BC she was somewhere Egyptian Greek. Um, so this comes to the end of the hypnosis session 2. So with that, the chapter 2 comes to an end, and the second twist is after she goes back home, she feels so much better. She's having amazing sleep. Her symptoms have drastically reduced, and she's feeling a lot better. And the thing was, Dr. Weiss thought that, okay, you know what? I have freaked out this lady. She's going to be so scared for her life. I don't think she will ever return. But surprisingly, Catherine does make a return, and she is ready to go for another session. So now that session part we are going to see, which is going to be chapter 3. I'm not going to say because we're going to have lots more getting revealed in chapter 3 and chapter 4. But again, a bit more into Dr. Weiss and his theories, okay, of why he thinks Catherine is not crazy. And so, few things that he think. If it's a dream, you can't have specificities in the story. So her story was very specific. Also, he was seeing if she had any sort of antisocial behaviors and anything, but no, she didn't have any of that. Was she delusional? No, she didn't have any delusional abilities. She was, specifically speaking, did she have any kind of multiple personality disorders? No, she was very much oriented. She was cognitively all right. When she spoke, she knew that she was in the present and she was that person, and whatever she spoke, and everything was oriented with her reality. So he had done all of his analysis, and he felt that, and he knew for sure that she was not crazy and she was not having any kind of psychological illness. If she was not having any other issues, why was she talking about things that has, at least as we know, has never happened? And that's when he thinks, okay, there has been people who have spoken about um, living different realities, rebirth, and that's when he starts reading about all these things, and he feels it very weird. Like, I'm a man of science, why am I reading all this? Um, but that's where I'm going to stop for today. I hope this story is getting you guys all excited. I'm pretty sure there's a lot of people who are of science who are worried, just like Dr. Wise, of what's happening right now. But yes, we will look into chapter 3 and chapter 4 and uncover more mysteries. Yes, thanks.
Thank you, Pavithiraa. Yeah, it's very interesting, isn't it? So, such a wonderful deliver by you, let's say. Um, Thanks for that. So, this is the book that we wanted to share with you all today. And sold almost 2 million copies, it seems, so far. Um, Very, very good, wonderful. One of the most suggested books that I came across by a lot of people whom I know, those who are into spirituality, those who want to understand about life. And pretty strange, isn't it? Like what Dr. Weiss is undergoing. Like, it never believed in reincarnation or the life after life or nothing. But then uh, these kind of things, the hypnotism, things like that, when it reveals, surely there is something, isn't it? So I also came across things like near-death experience. I think these are all like almost similar. And here the takeaway is what we need to always keep in our mind. Um, we have to analyze logically and understand, try to understand what is the truth, what that really is going to help us in our life. And if at all, if there is a reincarnation, okay, fine. If it is not, then still fine. Am I happy? And if I am not, like Catherine, for example, what is making me to not be happy? I think that's what we have to ask, like question. That's what I like I understood from this two let's say these two chapters. Like, okay, we got some problem. What's the root cause of that? And why do we suffer? And if I suffer, and is there any solution for that? And if it is, yeah, then what's the solution? So there are plenty of solutions, and there are a lot of tools to approach towards having a better life. So one of the techniques is hypnotism, I believe, and you could also refer to another person called Dolores Cannon. So she's also a wonderful past life regressionist through hypnotism. Yeah, so this is all what I wanted to share. And after once we read this book, you'll understand more about reincarnation, past lives, and it is not like a simple. It's kind of truth, isn't it? It's not, you can't lie and you can't fake things and making 2 million people to believe in some random stuff, isn't it? So there is something in it, and let's see what's going to come up. But thanks a lot, Pavitra, for the wonderful storytelling today. It's not story, of course. Yeah, it's a book reading. Yeah, thank you. If any of you guys have anything to share, don't hesitate. Yeah, go ahead, Nina.
Yeah, I just wanted to say her story, Pavitra, the book she read, is very similar to certain people that I have spoken to before. Some people talk about different realities. They talk about their past life and how the soul never dies. And in different lifetimes, they've lived different experiences. So it's not something people make up. That this is the truth, you know. Um, so this was very interesting. Dolores, I know her very well as well. She's a very famous author. I think she's got a YouTube channel as well. Uh, if you haven't if you haven't heard about it, maybe if you guys should check out. She talks about the different planet position, spirituality, afterlife, the position of the stars, and how different experiences have different results. So she's a very interesting lady. I'm not sure if she's passed away or she might be still alive, but she's also have a center in London where she does hypnotherapies, which is something that I have tried as well in the past before coming to meditation. And then somebody told me that hypnotherapy will only give you the pill for your problem, for your traumas or your problems in life, but it won't give you the cure. And it was very funny. A couple of months later, I met Arputa, who introduced me to meditation. So, this is all meant to be happening. Yeah. So, yeah, that's just my take.
Thanks, Tina. Maybe who knows? In your past life, I was your trigonometry teacher.
Who knows? Who knows?
Yeah, just that's really something to be decoded, isn't it? Like, as I know, heard about hypnotism. So don't blindly like go and any of us here just like that going and get to know about what is my past and everything. Don't like poke into those things too much, because sometimes things may go not in a good way. You know what I mean, Gina? Like, imagine the person that whom you are living with currently, and if there is something to be sorted out with that person, and you came to know that in past life he killed us, for example, then uh, and he is your current brother in this life, and you came up to live and to sort out certain things, and then there could be something again going wrong. These kind of things I heard when it comes to past life regression, but it's good to have certain past life regression, and provided we have a strong heart, and then I think everything happens for a reason. Yeah, thank you.
Yeah, so I only did 1 or 2 sessions, but I knew that this wasn't the way to 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 cure uh
Mm,
anything. So meditation is the way, basically. If you want to cure for permanent solution, meditation is the way.
okay.
Yeah. So, for me, it is like a nice one, Pavitra, because the storytelling, what you did, like the way you have narrated, it is really nice. And for me, this one made me a little curious about like I don't want to dig the past or something like that, but still it makes me curious to see what would have happened or what things. Those certain things always makes us curious to know whether whatever we have forgot or whatever we don't know, all those things make us curious to dig into it and know things. Uh, that's a nice one. Yeah. Thanks.
I know. Yeah, it's very true. When I first learned about the fact that this is true and you can actually go back and access your past life and these kind of stuff, and you can actually know what went wrong and stuff. But yes, exactly. It starting even I was like extremely curious about these things. I really wanted to look back into my life, and I also know curiosity killed the cat. So then I was like, okay. But it's not easy to access past life. It's not easy. So that's one point. And the other thing was, in due course of time, I understood there's a reason why it's hidden, and there's a reason why we are not supposed to see that things. So it's best left unless and until it's really, really required. Then that will also come and open up in front of us, like how it did for Catherine, probably. But then I realized, okay, it didn't open, then there is no reason for it. So let's not look into. The truth is, like something that our friend or whoever said 5 days back, we are not able to forget that. Something that happened 10 years back in the family, we had one stupid fight probably, and we are like, that man, I'm not going to talk to him again. I know what he did to my family. So 10 years back, we can't forget that. How will we be able to accept what happened in our past life? The people who we met, especially if we know that those people are going to repeat, they're going to come as different forms in our next life. I thought that was not my cup of tea, so that's where I made peace with it. So yeah, thanks.
Yeah. Thanks for it. I wanted to just say the way how you narrated was simply very good. Just I wanted to appreciate that point. I don't know how in a very flow. The flow was very amazing. You didn't forget even a single point. I think the first and second chapter. Yeah, I think whole book. I think you have to cover. I was thinking maybe tomorrow I can do this, but I don't think so. I will make just this first. So better you can carry on with these things.
Okay, don't worry. I'll finish this book for you guys.
Thank you.
Yeah, even I'm excited. I want to know what's happening.
Yeah, it's very intriguing. Okay. If there is no more question or sharing, then let's say we wind up for today and meet you all tomorrow in another wonderful session with another wonderful sharing. Thank you.
Yeah. Bye bye. Good night.
Thank you.
Good night.
Bye. Good night.